heartily welcome the honorary professor in the University of Hyderabad, and he is the founder trustee of Infection Control Academy of India. He's a great physician, public health specialist, social entrepreneur with interest in business, verticals of high social impact. His motivations, his counselings led him to a great mentor, here and there imparting knowledge to startup and micro small enterprises, a man of encomiums, a man of accolades, a man of changer of life. That is none other than Dr. B. Ranga Reddy. Please give a big hand, Dr. B. Ranga Reddy.
Good afternoon, ladies and gentlemen, friends, colleagues. It's indeed an honor to be here along with you, to be part of the first international conference on health and pharmaceuticals. I think, a couple of things what I have observed, but I think the whole thought of giving back to the society and be something in the process of actually making a change in the society. I think that is a very honorable and very enlightened kind of thinking, which we all should be appreciating. Thank you very much, Nageshwara, for inviting me to this conference. Let your spirit not be dampened. Probably, this is an opportunity to sharpen probably the agenda of the conference so that the people can connect to the idea. I think, that is something probably my 10 cents and unsolicited advice. Now, let me go into the topic. As colleague has introduced, basically I am an infection preventionist. Infection preventionist is somebody who takes care of preventing the infections even before the start, right? And I think about a couple of years back, if I said infection preventionist, people used to scratch their head and ask, what is it about? I think today, after going through the devastation of COVID-19, probably there is not a single person on this earth of 7.6 billion who would ask what is infection, right? I think, that is the silver lining of it. Slowly but steadily, probably we are trying to understand the significance of infections and the devastation they can bring if we are not going to really take care of them, and really if we are not going to be prepared for the kind of eventualities what we had. So without much ado, now let's straight hit into the topic of the day. I was asked actually to talk about the growing importance of infection prevention and control, especially considering what is happening with our world with all the pandemics and endemics. So I would be, since the audience is not homogeneous, I understand the people are coming from different walks of life. I would not go into the detail. Rather, I would try and touch upon some of the aspects which are going to give a general idea about infection prevention and control and the elements of infection prevention and control. And also talking about the healthcare associated infections and the determinants of those infections which are happening within the healthcare realm, and the guidelines which are given by the World Health Organization. Then I would briefly touch upon the rising threat of infections and the cost it can have, right? And then probably finally I would be talking about the frequency of the pandemics, epidemics, and also the costs which are related to that, and what are the measures which we need to take in order to ensure that the preparedness is going to be high all the time. Well, this is a very good quote, and probably, I would love always, especially when I see a very heterogeneous kind of crowd in my audience, where the people are not directly related to the infection prevention or infectious diseases or the hospitals, etc., etc. There is a quote, I often keep, flashing on my presentations. Whenever there is an epidemic or the pandemic or the public health emergency or the outbreak, we think that suddenly it has fallen from sky somewhere, right? And usually we are not prepared, right? Either it is in recent times Ebola or the MERS or the SARS or currently the COVID-19 with all the manifestations and all the variants. Every time when it happens, when it occurs, we suddenly wake up thinking that it has suddenly dropped from the heaven or whatever it may be. So I think Albert Camus, the guy, he wrote about it in 1947 in his book called The Plagues. I think that that is still valid today. Even after 60, 70 years, 6, 7 decades, we still feel the same way as it is written here, right? I think that is where probably the change had to happen. Now, coming specifically to infection prevention and control, what is it? What is this animal is about? Infection prevention and control, it is a scientific approach and practical solution designed to prevent the infections, especially in the healthcare, right? Of course, even at the communities it is important, especially when we are talking about the current COVID-19. The problem of infections, it is not only about the hospitals or the healthcare system, but even it is about the communities. And infection prevention and control is a very recent subject or a recent kind of theme which has come into the light. About 12 years back, World Health Organization, after looking at the rapidity of the infections and also especially the healthcare associated infections, it started talking about the infection prevention and control, all right? I would take you through some of the history of it so that you can get a sense of it. Infection prevention and control, as I said earlier, it focuses on evidence-based practices and also the procedures that can prevent or reduce the risk of transmission of the microorganisms from person to person or from environment to the person, etc., etc. Now, what is the importance of infection prevention and control as a theme? First is, it can prevent the harm to patients, health workers, the visitors, or anybody who has some kind of association with the hospital or the healthcare system. They would be definitely benefiting from the practices of infection prevention and control. Similarly, preventing and reducing the transmission of infectious diseases that pose the global threats. I need not say, you already know, that is COVID-19 like situation, and also the pandemic influenza, which is called as Spanish flu, which has happened exactly about a century back, which is now kind of told that, probably COVID-19 is comparable with something like Spanish flu or the Ebola virus disease, etc., etc. Clean, safe care is a patient right, right? When we talk about giving the care to the patient, it is not just giving a few pills or, taking few scans and sending him out, right? It is about clean care, clean and safe care, that unless we are going to have that clean and safe care, we will not be able to say that, we have done our job within the realm of healthcare system. So I promised that, I would talk a little bit about the history, right? If you go back to the history, pre-1800, the early efforts had been made in terms of the wound prophylaxis, because those days, as you know, the wars used to be very fierce. The continent to continent, the people used to be constantly on the wars, and the wounds used to be the major, aspect of killing the people, especially the soldiers and also those people, who are working in the war kind of scenarios. From 1800 to 1940, I have taken a big leap of almost 1.5 centuries. The people like Nightingale, Semmelweis, Lister, the Louis Pasteur, and other scientists have done a phenomenal job in terms of bringing some concepts of infection prevention and control. And 40 to 60, if you take those 2 decades, had been very important because you know that Alexander Fleming has discovered penicillin, which has become very widely and very popularly been used during the Second World War, which has saved millions of the people. And but unfortunately, very quickly, the resistance to penicillin has started becoming a major problem. And the first one is that Streptococcus aureus has started actually seeing the kind of resistance, which has pushed actually the healthcare institutions and also the doctors to think something, a measure which can ensure that the penicillin is going to be long lasting in terms of the sensitivity, in terms of its effectiveness for using and treating the infections. And then 1950s to 70s, especially in United States, the surveillance has started, and documentation has started, looking at what kind of infection control programs need to be done, what should be the procedures, protocols, etc., etc. And 80s, that HIV, recently we have celebrated World HIV Day on the 1st December. I am sure most of you are aware. 1980s, the sporadic outbreaks started initially in Congo. Then they spread like wildfire into many continents, including United States and Europe. So as a response to those kind of outbreaks which were happening with HIV, or which we call it as a disease, which is AIDS, right? A lot of procedures had been streamlined in order to prevent the transmission of HIV. And then 1990 onwards, the people started realizing the blood-borne pathogens, because prior to that, not much attention was given, but especially in the backdrop of HIV, the people started actually thinking about blood-borne pathogens like CLABSI, that is the bloodline, whenever you are going to give have any infusions, etc., you put the needle, that is called as CLABSI, right? And then 2000 onwards, we started looking at the pandemics, and we started talking about the patient safety as the center of the care what we provide to our patients. So what is infection? We talked about infection prevention and control, a little bit of the history, how it started and all that stuff. What is infection? Infection is nothing but invasion of microorganisms, and then when they enter, causing the growth of those germs in the body, or the replication. Nowadays we talk about especially coronavirus. We keep talking about a Delta virus, which has got the ability of X, and then Omicron having 6x of Delta, right? That is the replication. What happens once actually it enters, evading the barriers what we have, they enter and start replicating, which can cause harm to human beings. These germs can be bacteria, the virus, it can be fungi, it can be any other microorganisms. When they are introduced into our body, they start spreading all through it and causing so-called infection. Infection may be local, or it can be generalized also. When it is generalized, it is called as sepsis. When it is localized, depending on what is the part where this infection is, it would be given a name specific to that particular organ or that particular system. Once the infectious agent enter the host, it begins to proliferate. That is what we talked about, and the defense mechanisms automatically are going to be suppressed sometimes, unfortunately, which is going to cause the further escalation of the situation, leading into some kind of symptoms like a fever, etc., etc. Right? Patient may acquire infection. If we are talking about the healthcare scenario, they may develop this infection before admission or after the admission. If it is within 48 hours, that is also considered as healthcare associated infection. What are the healthcare associated infections? Healthcare associated, earlier they used to be called as nosocomial infections. They also used to be called as hospital acquired infections. But World Health Organization for last few years started talking about healthcare associated infections so that it can holistically represent all those infections which are happening as a consequence of the hospitalization, as a consequence of the care which is given within the realm of the healthcare system. HAs are mostly caused by microorganisms which are resistant to one or the other antibiotic or antimicrobial preparation. Antibiotic and antimicrobial, they are not one and the same. Antibiotic is when we are going to kill with that particular product predominantly bacteria, and antimicrobial, it covers the entire gamma of all the microorganisms. It is antibiotics, antivirals, antifungals, etc., etc. So, healthcare associated infections are which we colloquially call it as HAI, are a major public health problem with a significant impact on both morbidity and also the mortality. And of course, it also diminishes the quality of life. It also has a huge impact, especially in the low medium income country kind of scenario. When we talk about our brothers and sisters in Egypt or in other countries, they have a similar situation, right? We all belong to low medium income or low medium resource countries where we have similar problems in terms of infections and also in terms of the kind of resistance of various microorganisms to the currently available arsenal of antimicrobial agents. But the lucky part is when we talk about HAI, they are preventable. It is not that they had to happen, right? They are preventable if we are going to have some effective infection prevention and control measures, which I am going to talk a little later during this presentation. So just to summarize on HAI, these are the infections which happen within the hospital, either before actually the admission or within 48 hours. If it is after 48 hours, if it is going to happen, then it is a healthcare associated infection. That means the person has acquired the infection within the hospital, right? If it is within 48 hours or before admission, then it is not a HAI. That means it is not healthcare associated or healthcare acquired infection. Okay, is it clear? Right? Right. What is the impact? The impact is enormous. As I talked about earlier, it has got not only the clinical outcome impact, but it also has impact both on mortality, the economics, right, and also the social aspects of it, right? And unfortunately, in high income countries also, the incidence is very high. We may imagine that probably United States or Europe having a better healthcare system probably would not actually deal with such kind of infections. No, unfortunately it is not true. Even in developed countries, the incidence is something between 5 to 7% of all the patients who get admitted into the hospitals. At one or the other time, they would be getting an healthcare associated infection. But if we come to the developing world or low resource settings or the LMIC, that is low medium income countries, unfortunately the incidence is even higher. It could be something like 3-5 times higher, right? So if you look at the cumulative thing of all the countries, who are reporting, of course, not every country is reporting, every country has the data, unfortunately. Even if we talk about India, we don't have any data which is of relevance or which is kind of auditable data. There are few institutions, anecdotal kind of data available, but that is not sufficient to really confidently say what is the incidence of HI in the Indian subcontinent or India itself. So broad number, a ballpark number can be something like 10 to 15% within the LMIC within India probably. And especially in the ICUs, the problem of healthcare associated infections is very high because most of the ICU people are already immunocompromised people, and they usually are on probably a ventilator or some kind of support systems, and they have got a high probability of acquiring an infection within the hospital, right? And that goes up to 30%. Means 30% of every third person who enters into an ICU is kind of vulnerable to get one or the other infection. Newborns are also at high risk, and thankfully, the Indian government has started focusing on that. The childhood mortality and also the mother are the people who are giving the birth to the people, the pregnant women. That has become the focus because child and mother mortality has been taken as one of the priority sectors. I am hopeful that with that our incidence of both pediatric or the childhood and also motherhood kind of infections would come down. What are the common determinants? One is if we talk about generally, regardless of resource availability, that means either it is United States or India, then it is inappropriate use of invasive devices and antibiotics. You know that today, the moment you enter into the hospital, I'm sure most of you would have noticed, first is they would put a cannula, right? And start putting a drip, right? That itself is a risk, right? And or if a person is entering there and unable to pass the urine, then he would be put in a catheter, right? If a person is actually having a problem with defecation, then he would be given enema. I am talking about very simple things, which are the procedures. All those procedures could cause a side effect which is called as healthcare associated infections, right? So that's why while making use of them in order to give a higher level of service to the patient, we should be also mindful that we had to use them appropriately, right? If we don't, then it is going to cause the healthcare associated infections. The same thing with antibiotics, right? And most of the times, we are very indiscriminate in terms of actually giving antibiotics, because the moment actually patient enters, you have 10 or 15 attendants coming and asking, doctor, we have brought him 6 hours back, you haven't done anything. So the doctor is also under pressure to immediately put him or her into the antibiotics without actually waiting to see what kind of actually antibiotics would work on that person or doesn't work and all that stuff, which also goes as inappropriate use of antimicrobials and antibiotics. And high risk diagnostic or therapeutic procedures, you know a lot of them, then immunosuppression, then substandard application of IPC practices. What do we mean by that? When we talk about substandard, that especially after COVID-19, now everybody is aware that you had to wash your hands or rub your hands with some kind of sanitizer or a hand rub, etc., etc. It should be a product which is of good quality, which is meeting certain standards. If we are going to use a product which is substandard, which is not actually appropriate for the given situation, then definitely it is not going to work. So that is what we talk about substandard application. Or another situation is, a lot of people, they go to the restroom, and just because, somebody told that, you had to wash your hands, you just open the tap, put the hands and come out. That is not going to help you in any way. There had to be a minimum of 20 to 30 seconds with a particular process, you had to, with a particular sequence, you had to do your hand washing or hand rubbing. If you don't do that, if you are doing just nam ke vaste, just for the sake of it, then you are not going to have the impact. That is what we call it as a substandard application of IPC. I would not dwell into much of the details. I can go on talking about 100 things in terms of substandard application. But this could be a good example to understand the hand hygiene, because we all do it day in, day out, and that is what probably you can relate to. When it comes to the limited resource settings, in addition to all the other problems, we also have a problem of non-availability of water. How many hospitals you would have seen? The water is not available, or the water is of a very poor quality, and sanitation is poor, right? When we say sanitation is poor, what clicks in your mind? A general hospital, right? Or even some of the corporate hospitals where the sanitation levels would not be very high. The waste management, which is inappropriate, throwing the bandage, or anything, what is being already used, right? A biomedical waste, including the needles, etc., etc. They just throw it without any consideration, without actually having, pre-treated, which can contribute, in a big way to the healthcare associated infections. Insufficient equipment, that is a given problem, everywhere. We usually don't have the sufficient number of equipments to take care of X number of patients who are supposed to be in that. So we keep moving the same equipment from one place to the other place, which definitely is going to be a cause of transmission of the infection from one patient and one bed to the other bed. Understaffing, which is, I'm sure you can understand. As an intern, when I was a young doctor, working in a ward of 100 patients, we used to have one doctor and two nurses, right? It is absolutely inadequate. You can't actually look at 100 patients, right, and give the quality of the service, right? If you had to spend a right amount of time, not only actually diagnosing and treating, but also counseling and giving a proper advice, it is not sufficient, right? We need to have that adequacy, and absence of local, national, and also international IPC guidelines, which makes it very, very difficult to have the control. So in order to handle this, World Health Organization has come with the IPC guidelines. IPC is Infection Prevention and Control Guidelines, with a motto that healthcare without avoidable infections. Means any infection which is avoidable should be avoided with the application of the right kind of procedures and kind of protocols which had to be applied within the realm of healthcare system. And World Health Organization has very clearly talked about protecting the patients is one part, but also protecting actually the healthcare workers who are giving the service to them is also equally important. Because if we don't have both of the things concurrently happening, there is always this cycle of transmission will go on, right? So protecting patient and healthcare worker lives across the world through collective excellence in infection prevention and control is the motto which has been talked about by World Health Organization. Why IPC is so important in the global health context? It is important because it occupies, as I said earlier, a very unique kind of position in the field of patient safety and the quality of care, as it is universally relevant to every healthcare worker and also patient and also other people who are involved with the healthcare system. Without IPC, it is practically impossible to achieve quality healthcare in any country or in any system, whether it is a private or public healthcare system, whether you have a five-star building or a general ward, it doesn't matter. Everywhere, infection prevention and control had to be the priority if we want to provide the quality healthcare and also to ensure the patient safety. So these are the components I would not read out, but I would definitely say that one of the major things is education and training. This is where we lack most of the times. Most of the people, even working within the healthcare realm, they have very poor cognizance or very poor understanding about the problems of healthcare associated infections and also the healthcare associated infection related protocols and the infection prevention and control norms. So a big part of our work actually goes on into education and training. Of course, others are equally important. There are total 8 core components which are released by World Health Organization, which are to be followed by every country. I would not go through all the slides because I think the time is up. I should stop somewhere. But before going before stopping actually, my today's talk, I would definitely like to bring your notice onto something which is called as the chain of infection. I think irrespective of whether you are a healthcare worker or you are working in some other field, this is something which we all should know. COVID-19 has taught us that breaking this chain of infection is going to be very essential in order to take care of the current pandemic and also the future pandemics which might happen and which might be lurking around the corner. Because just about a month back, before Omicron was declared, we all were thinking, "Wow, everything is over. Now it is going to be safe." But Omicron has given us the indication that it is never going to stop unless we are going to not allow the microorganism to enter into us, and we actually do not take care of actually the transmission which can happen from us to the other people. I think that is a very clear indication which Omicron has given. So this, irrespective of either you are a common person or a healthcare worker, this should be essential to know that unless there is a susceptible host, the microorganism cannot actually enter, and unless you are going to allow infectious agents to proliferate, it cannot happen. Unless you are going to create the reservoir, it is not going to actually sustain. Unless you are going to have the portal of exit, right? You are not going to transmit it to the others. What is the portal of exit? Especially when we are coughing, right? There had to be a kind of way of not actually spreading the micro particles into the environment and to actually others, right? So we had to have so-called cough etiquette, right? Cough etiquette means when we are coughing, we should be mindful that we just put our hand like this and we are going to cough into the arm. So that way we can help ourselves and also help the people who are around us. The same thing of mode of transmission or transportation, then the portal of entry, and again cycle comes back to the susceptible host. So at every point, if we are able to break one link in the chain, we can actually break the transmission cycle, right? So that's why it is very, very important. I think I will leave this thought with you, right? Whether you are a healthcare worker or non-healthcare worker, so that you can take care of yourself, stay happy, healthy, and also safe, especially during this Omicron period. This Omicron may not be the last variant what we see of coronavirus, right? It might actually, as you know, that World Health Organization has denominated these things by Greek alphabets, right? It starts with alpha, it goes up to omega, right? These are the 24 alphabets. We have already exhausted 15 alphabets. 13, two of them are skipped because of whatever reasons they are. We are in the fifth alphabet now called Omicron, and from here we have another 10 alphabets to go. So in terms of variants, I don't want to scare you, but I want to actually give you the information so that we can be aware of this chain of infection and also where to break the chain, right? So let us stay safe through all the other 10 variants which are possible, right? And they might be highly transmissible, highly infective, they might be causing severe infection, they might actually evade the kind of immunity which we have developed either through the vaccines or through natural infection. But one thing is for sure, if we are going to do simple, logical things like hand washing, wearing the mask, right? I keep actually saying to madam that you please wear the mask, and it is not the time, when we need to sit without masks. I think, anywhere, especially, in a closed premise, we have to be mindful that, we have to wear the mask, not only for our own health, but also for the safety of the people, who are around us. So with those few words, I think let me stop here. Thank you very much. I have many slides more. Probably I will share with Nageshwar Rao. Probably he can share with all of you. If you have any questions, I would be more than happy answering at least a few of them.